Ever wondered what peptic ulcer disease is? Today, we'll delve into this medical condition, exploring everything from its causes and risk factors to its diagnosis and management. So, sit back, relax, and prepare to expand your knowledge on this fascinating topic. Peptic ulcer disease, often abbreviated as PUD, refers to painful sores or ulcers that develop in the lining of the stomach, lower esophagus, or upper part of the small intestine. The most common types include gastric ulcers, which occur inside the stomach, and duodenal ulcers, which form in the upper part of the small intestine. Several factors contribute to the formation of these ulcers. The first is an infection with the bacterium Helicobacter pylori, commonly known as H. pylori. Other causes include the prolonged use of non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen. In rare cases, a condition known as Zollinger-Ellison syndrome can cause peptic ulcers, as it leads to overproduction of stomach acid. Certain risk factors increase the likelihood of developing PUD. These include smoking, excessive alcohol consumption, and having a family history of the disease. Stress and spicy foods were once thought to cause ulcers, but experts now know that they only exacerbate symptoms. Speaking of symptoms, they vary between individuals. The most common sign is a burning stomach pain, which might feel worse when your stomach is empty. Other symptoms include bloating, belching, intolerance to fatty foods, heartburn, and in severe cases, dark or bloody stools. Diagnosis of PUD typically involves an endoscopy, where a thin, flexible tube with a camera is threaded down your throat into your stomach and small intestine. Doctors may also conduct a blood, stool, or breath test to check for H. pylori infection. Once diagnosed, the treatment aims to kill the H. pylori bacteria, reduce pain, and decrease stomach acid. This often involves antibiotics, proton pump inhibitors, and sometimes bismuth subsalicylate. Lifestyle changes, such as quitting smoking and limiting alcohol, can also aid recovery. Preventing PUD is largely about avoiding the risk factors. Regularly monitoring the use of NSAIDs, refraining from smoking and excessive drinking, and maintaining a healthy lifestyle can all help. However, if left untreated, PUD can lead to complications. These include bleeding, perforation, where the ulcer eats a hole through the stomach or intestinal wall, and gastric outlet obstruction, which is a blockage in the digestive tract. So, to summarize, peptic ulcer disease is a condition characterized by sores in the stomach or upper small intestine. It's usually caused by H. pylori infection or prolonged use of NSAIDs. Symptoms often include a burning stomach pain, and diagnosis is typically made through an endoscopy or tests for H. pylori. Treatment includes antibiotics, proton pump inhibitors, and lifestyle changes, while prevention focuses on avoiding risk factors. If not managed properly, PUD can lead to serious complications. Remember, knowledge is power. Understanding peptic ulcer disease can help you identify it, manage it, and potentially prevent it. So stay informed, stay healthy, and keep learning.